This week, what I wanted to talk about was the elephant in the room and how to lead it out. Essentially, what we're going to be talking about is the in-clinic laboratory quality challenges. And this was an article just recently published in the Journal of American Animal Hospital Association and just published in December 2014. So I think that this is a very hot topic right now and something that as we continue to grow as a profession is going to become more and more of a bigger deal. And I think there will be some guidelines that are going to start being published so that everyone is on the same page when we're talking about laboratory quality, especially when we're talking about the in-clinic, because a lot of what we do as veterinarians can be in the hospital with our in-house laboratory equipment and not necessarily everything's being sent out to the lab. So the clinical pathology laboratories are certainly, there's a variety of them, Antech, Marshfield, IDEX, there's quite a few depending on where you're at in your hospital and what area you're in, but there's quite a few point of care tests as well. And these are tests that we're doing in the hospital, whether that's on an instrument or whether we're looking at a non-instrumental test like a SNAP test or a heartworm test or something as simple as a urinalysis where we're having a lab technician look at that. So there's a wide variety of testing that can be done, as well as a large difference between the technical skills and complexity in those tests. Some tests you can have an assistant do with relatively no training, like a SNAP test, and some tests need to be done by a licensed veterinary technician or someone that's been well trained, like a blood smear and doing a white blood cell differentiation. So it is required to adhere to the manufacturer instructions on how to do those tests, but there really are no quality assurance procedures and programs that we have to follow as veterinarians. So again, just to kind of review some of the point of care tests, the non-instrumental ones like a heartworm test or a urine dipstick, and then the instrumental testing like hematology, where precision in sample processing is very important. There are quite a few electronic measurements and fluid reagents that need to be kept up. And then software needs to be updated depending on what program you're using and what instrument you're using. And there are limitations to these tests. So even though they're great tests, most of them are based on, especially hematology, measuring the size of the white blood cell or the size of the platelet. And so especially in a disease process, we may have large platelets or abnormal white blood cells, and we're not going to be able to see those on a hematology printout or on the machine itself. So that's really where the blood smear comes into play and having an actual LVT review that blood smear under the microscope. So in human medicine, diagnostic laboratories are very different. They are all subjected to federal regulation in the US. The instruments and the test kits themselves are classified according to the complexity, and those are high, moderate, or waived. And so there are quality procedures required for both the moderate and high complexity instruments. And there's point of care testing sites that must be followed under federal regulations and guidelines, or they can choose voluntary accreditation by an approved organization. So there's definitely people that are providing checks and balances in the human medicine, whereas we don't really have that in our veterinary medicine, especially in our in-house laboratory equipment. So it's really up to us, because there is no regulatory oversight in any setting, whether this is the laboratory equipment or the manufacturers of the equipment. Veterinary practices use these instruments more operating as a de facto clinical pathology lab. And so again, it's really up to us to make sure that we are the quality assurance and that we have some procedure set in our own hospital, whether it's a general practice, specialty hospital, or university setting, where we're going to keep up with these guidelines and try to make sure that we have a high quality standard of care. So there's two different ways that we can promote the quality of laboratory testing, and that's quality assurance, or QA, and this is where the laboratory procedures that monitor and improve laboratory performance come into play, and we're going to minimize error in all phases of testing on an ongoing basis. This is more of a human checks and balances. On the flip side, quality control, depending on the machine, some of these machines actually have quality control procedures or performance data built in. And it's up to us, though, as veterinarians or the technician that's running the in-house lab to make sure that we are keeping up on these procedures. There is no list of qualifications or timing on how many times a week or month that we have to do these things. So again, it's up to us to write our own guidelines and stick with those. And so this is really the running controls in a hematology lab equipment or a serum chemistry panel to make sure that we're meeting guidelines. So really the elephant in the room that we're talking about is the quality of veterinary in-house lab testing, and that really the QA and QC are lacking. And it depends on each hospital, but some hospitals, may not be doing any quality assurance or quality control procedures. And there are some hospitals that have very clear defined weekly scheduled, monthly scheduled routine things that they're doing to keep their equipment up and making sure that they're providing a high quality lab service. And I think it's important for us as veterinarians, as we move forward in the profession and as we are continuing to offer newer and newer diagnostics every year, that we're providing high quality patient care and minimizing our liability, because we're relying on a lot of those tests that we're providing in hospital. So sending it out or in clinic, well, there's a lot of pros and cons to the in-clinic testing. Certainly financial cost, both on the equipment, the maintenance contracts, and disposables is something that comes into play for us, especially if you're a practice owner. And then the continual operation of the equipment and continual maintenance. That's going to be both a time cost because you're having to pay a veterinary technician or a licensed lab technician in your hospital to do those things. And then also the cost for the ability of resources. So having the space in your hospital for these this testing equipment, the personnel, and the training that needs to be done. And many of us, we have one or two people that are in the lab or the most trained in the lab, and those people are teaching the other people in our hospital. Reference laboratories, however, though, most of them have staffing that is certified. Again, though, this is not a routine thing in veterinary medicine, and so it depends on which lab you're sending to and what practices they follow. There is a variety of tests that can be offered as we send them out rather than in the clinic, and some of those tests we're not able to do in the hospital, but a good one would be leptospirosis titers. It's important to know that when you send out a leptospirosis titer that you're sending it to a laboratory that abides by the standards of care, and most of the large laboratories right now in veterinary practice are abiding by those guidelines. And when you send a follow-up titer, I think it's important to note that you should use the same laboratory test so that you're comparing apples to apples when you're doing repeat titers. So the data being reported could be different between the labs, which is important. And then certainly customer service. When you send blood work out to a laboratory, it is nice that many of those labs have hotlines, people that you can call not only on the sampling questions and procedures, but also on the results of the test and getting the most out of that. So most veterinary practices in general have a combination of these two, but making sure you have a good mix of both. And for those tests that are in the clinic, that we're keeping up on the best standard of practice that we can. The challenges for in-clinic testing, though, most of these tests are performed by veterinary technicians, and as many of us know, there's a variety of different levels of certification, aptitude, and interest. There are some veterinary technicians that are very interested in in-house lab, blood smears, doing white blood cell differentials, and there are other staff members that are not as well trained or may not have a special interest in lab technology as well as in-house clinic lab testing. Most hospitals can have a problem with turnover as well. When we have a trained personnel, if you have that one person, as I mentioned, that's trained in the lab, and then that person leaves or moves to another hospital, now you have to retrain and kind of start over. So it's important to have a few people in the hospital that can do the training and kind of spread out the training responsibilities. Understanding quality assurance and quality control. Again, there's very little information in the veterinary world and training, and there's little background or very few training programs in lab quality management. So a lot of it, to be honest, is usually learn as you go and learn from the laboratory hospitals that are providing the equipment. And so many of the manufacturers of the equipment can provide you on information on how to do quality assurance and quality control procedures, and then you can develop your own program that works best for your hospital, depending on how often you're using that lab equipment. Financially budgeting for the cost of quality assurance and quality control is important, as well as keeping up on the equipment and making sure that when new equipment arrives that you have a program or a rental service where you can update the equipment as newer equipment becomes available. Resources for the clinic can be sparse, but I would definitely encourage you to have several books or wall charts or things that your veterinary technicians can go to when they have questions on what they're seeing on the urinalysis or what they might be seeing in the blood smear, and then also encouraging them to grab you to evaluate any blood smears or anything that may be abnormal, and sending that out to an external resource if needed so that you can verify what you're seeing. As I mentioned previously, there are several of the manufacturers that provide hotlines for help, as well as a lot of the laboratories like IDEXX and Antech where you can call and you can ask for advice not only on the equipment and the blood sampling, but also on the results of those tests. And so I think that in general, in-clinic does have its challenges, as all the instruments can degrade over time. And it is important to keep up on the point of care instruments as they do vary. There's newer tests coming out all the time. A good example is the Lyme Snap test. There's definitely several varieties and newer versions of those testing modalities. And it's important as a veterinarian, especially a practice owner, to make sure that your hospital is keeping up on those things. But I think that the benefits of providing a pretty instantaneous result to the client or a result same day in the hospital not only provides a good relationship with the client because you are getting the information back to them, but it also provides income for your hospital as well, as you're doing most of those tests in the hospital setting. Possible solutions, though, for us as veterinarians, I think that depending on what state you're in, your continuing education guidelines may vary, but I think that providing continuing education not only for yourself, but for the lab technicians that are providing the laboratory equipment and the testing in hospital, it's important to support them. So having continuing education support for them, written guidelines and resources available in the hospital. There's definitely specialty certification for veterinary technicians in the area of clinical pathology, as well as certain online courses that they can take that can increase their level of training, as well as provide a higher level of care for your patients in your hospital. And I think that there are quite a few external quality assessment programs for veterinary practices, and so having someone come into your hospital if needed is an important add-on for the in-house laboratory equipment and the testing that you're providing for the clients. And I think that there can't be enough said about having technicians that are interested and excited about laboratory medicine and are able to provide a good example is an excellent blood smear evaluation. I think that there really shouldn't be any CBC done without a blood smear evaluation to follow it up, so that you're not missing any of those abnormalities that are definitely not going to be picked up. Even with the best of a hematology machine, you may not see some of those abnormal white blood cells or toxic changes to a white blood cell or increased band number of neutrophils that you're not going to see with an actual machine test itself. There are quite a few veterinary national organizations as well that provide additional training and support, and I've listed those there. The American Society of Veterinary Clinical Pathology is a great one. There's also the Academy of Veterinary Clinical Pathology Technicians. Again, great resources to go to get additional training, online webinars, online CE, as well as some on-site training opportunities. So conclusions, there's definitely relative neglect in ensuring quality in in-house lab over the past 30 years in veterinary medicine. And I think as we continue to provide more and more to our clients the in-hospital setting, it's important to promote and maintain the quality of in-house lab testing and thus providing the highest quality of care for our patients.